I think we are live. Welcome to the 94.3 FM Radio 1 कोलकाता's Facebook page. मैं हूं अरविंद और मैं हर सुबह 94.3 FM पर 7 to 11 झकास मॉर्निंग्स का शो करता हूं और बड़े लंबे अरसे के बाद I'm actually going on Facebook Live from our page. So the reason why आप और हम यहाँ पर आज इकट्ठा हुए हैं, मैंने आज सुबह रेडियो पर भी ये बात कही और you can also comment in क्योंकि मैं चाहूंगा कि आप अपने सारे सवाल आज करें. I have an incredibly special guest और कल का डेट ऐसा डेट है मैं नहीं never underestimate the importance of a fight back. किसी भी मेडिकल एलिमेंट में sometimes the fight or the war is started by the disease और इस केस में इस डिजीज का नाम है कैंसर. लेकिन इसका जो डी एंड होता है ये हमारे हाथों में है. हाउ वी अप्रोच द डिजीज, एक फैमिली का सपोर्ट, प्रॉपर डिसीजन मेकिंग और सबसे बड़ी बात अगर अवेयरनेस हो वेयर वी कैन एक्चुअली प्रिवेंट समथिंग फ्रॉम हैपनिंग टू अस. इस पैंडेमिक ने अगर हमें कुछ सिखाया है दैट आवर हेल्थ इज ऑफ utmost important to us and it's important that we have knowledge of what we are getting into. अगर वो knowledge सही रहा, अगर आपको guidance सही मिला, then everything else quickly falls into place. Well, 4th of Feb is celebrated, acknowledged as World Cancer Day. When I say celebrated, because we spread awareness about cancer. कैंसर के कई रूप हैं, कई फॉर्म्स हैं और दुनिया में शायद ही ऐसा कोई परिवार है which has not had a cancer victim in the family. And most times it happens when you're least expecting it. आपको लगता है कि आपके फैमिली में किसी को हो नहीं सकता और तभी जाकर होता है. Hi Vijayalakshmi, good to see you. Hi Rumnadi, good to see you. And a huge shout out to all the ladies watching this broadcast. I have an incredibly special guest. I'm not going to waste any time. बहुत प्यारी है. The only introduction that I have for her is she's a fantastic doctor, but also a brilliant human being, a gem of a person, if I may add. Dr. Suma Chakraborty, consultant radiology and imaging from Peerless Hospital. आज मेरी special guest होने वाली है. And I like her to come on the screen ताकि हम और शुमा दी मिलकर आपके सारे सवालों का जवाब दे सके. विवाश भट्टाचार्य, गुड इवनिंग. सुष्मिता रॉय, गुड इवनिंग. अच्छा प्लीज আমাকে স্যার বলে ডাকো না, কল মি অরবিন্দ কিংবা অরবিন্দা. ইনফর্মাল অ্যাপ্রোচটা খুব ভালো লাগে. সুমাদি কেমন আছো?
একদম ভালো আছি অরবিন্দ. It's impossible to be not happy when you are on the screen and speaking like you do.
Okay, we are going to be talking about a lot of serious topics. लेकिन सबसे पहला कॉम्प्लीमेंट तो मैं सुमादी को देना चाहूंगा that you have such a beautiful smile. मतलब ऐसा स्माइल हम कहते हैं रेडियो पर, it's a smile from the heart. जो दिल से हंसता है, you make the world smile around you. Okay, ma'am, please feel free to ask in all your questions. We are here only for you. और ये जो लाइव सेशन है, मैं अब सबसे हाथ जोड़कर रिक्वेस्ट करता हूं, try and follow this because you could end up saving a life. आपको शायद इस वक्त लग रहा है कि I may not have cancer, so why should I watch this? But at some point of time, touch wood, अगर किसी को family friend या relative or anyone goes through a traumatic phase, this kind of conversation gives you subconscious mind में হ্যাঁ আমি শুনেছিলাম এই যে একটা আরজে আর ডক্টর সুমা চক্রবর্তী কথা বলছিল এটা করতে হবে, and that just could be the game changer between life and death. Ma'am, सबसे पहले 4th of Feb is acknowledged as World Cancer Day. How aware are we about cancer as a society? That's my first question to you. We know cancer kya hai, how aware are we in India across the urban cities and everywhere of cancer as something that could happen at any given moment in our lives?
That's a very nice question because that makes us think. Let me start with the positive. I think overall there is a sense of awareness. I mean, the ladies and the gentlemen who have joined us today, for example, you said hello to so many of them. That's a big plus because they are open, they want to learn, they want to know. And, there is an atmosphere where, the medical fraternity wants to speak and the people want to understand and learn. Hospitals want to invest, governments want to, fund different projects. So that's positive. But sadly, I think we are still falling short of what we should be achieving or how much the awareness should be. And maybe it's partly because the dialogue between the two groups, the medics and the non-medics, is not perfect as yet in our country or in the world as a whole. So I think what we need to do is not just cry when a relative suffers or gets diagnosed with cancer or support them. That's very important to support them, but also think, what can I do what awareness do I need to change my life or change the lives of others in the family? How can I basically prevent cancer? So there are certain cancers which are preventable to a large extent, like for example cervical cancer, where there is a vaccine which can prevent lots of cases of cervical cancer happening. Then there is early detection, like mammography for breast screening, which we advocate for women above the age of 40. सो ऐसे कुछ चीजें हैं जिससे हम कैंसर को प्रिवेंट कर सकते हैं. ओके, सो दैट अवेयरनेस, ये क्या है, ये सबको जानना जरूर, सबके लिए जानना जरूरत है, जानने का जरूरत है. सॉरी, माय हिंदी इज
मैम आपकी हिंदी बहुत प्यारी है. आई वुड जस्ट लाइक टू इंटरप्ट. आपकी हिंदी बहुत प्यारी है. प्लीज कीप टॉकिंग इन हिंदी एंड इट्स वेरी स्वीट. इट्स वेरी वेरी स्वीट टू लिसन टू यू टॉक.
So one is,
Thank you,
sorry.
I'd just like to say hi to everyone who's joining us. Sumita, thank you so much. Arindam, good to see you. Nice question. Suchishmita Sharma says it's a great show. हमने तो बस अभी शुरुआत की है. We're going to ask more and more questions. और आज सुबह अनाउंस करने के बाद I have a long list of questions.
Okay, let's sit down.
Yes, you mentioned about cervical cancer getting a vaccine. Not many people know about it. सबसे पहले मैम, would you agree with me if I tell you, if I have a daughter in my family, मेरी छोटी बेटी है, how many parents know कि I think 15 या 16 साल के पहले you need to get this vaccine done. अगर ये वैक्सीन आप ले लेते हैं तब आपको होल लाइफ सर्वाइकल कैंसर को लेकर टेंशन लेने की कोई जरूरत नहीं. बट 9 आउट ऑफ 10 इंडियन फैमिलीज के जहन में सिर्फ एक ही बात होती है, আমার মেয়ের সার্ভাইকাল ক্যান্সার কোনোদিন হবে না, and that is a big problem. It's almost like this won't happen to me, so I don't need this. So before we move on to breast cancer, just tell me a bit about that vaccine, the cervical cancer vaccine that you actually mentioned.
Okay, so to help understand, cervical cancer is not always, but most of the times caused actually by a virus called the human papilloma virus. So जो virus इसको cause करती है, तो हम लोग अगर खुद को, जैसे कि कोविड के अगेंस्ट we are vaccinating ourselves, so it's very similar. हम लोग cervical cancer के अगेंस्ट वैक्सीन नहीं कर सकते हैं, लेकिन जो cervical cancer cause करता है, we can vaccinate ourselves against the virus that causes the cancer. So we actually vaccinate our girls, and also men can get vaccinated against human papilloma virus, which is the commonest reason for cervical cancer. And ये बहुत कम उम्र के बच्चों को दिया जाता है. You can start off from about 9 years, latest up to about 25 years or so, and different protocols are there. But it doesn't save us from every type or all of cervical cancer, but most. So it gives us a huge amount of immunity against cervical cancer. So please do what I would say, if at all from this session, जो भी आप सोच रहे हैं या सुन रहे हैं, इसको एक्शन में बदलिए. Maybe go to your family doctor or go to a nearby hospital, inquire about it, see what options are available and see what you can do. ये है informed consent हम बोलते हैं, कि ऐसे नहीं कि डॉक्टर बोल रहा है तो लेना है. तो आप उनसे जाके मिलिए, उसके बारे में पढ़िए, and I'm sure you will be convinced yourselves. तब जाके आप वैक्सीन लीजिए, and you can tell other people in the family. So definitely something to work upon.
Shumati, cancer में ना, there is the first part of cancer says CAN, which means you can fight cancer. लोग अक्सर ये सुनकर डर जाते हैं कि कैंसर से क्या होगा वो. And the first thing that a common person thinks, जिसका कोई मेडिकल नॉलेज नहीं है, कैंसर माने केमो होवे, केमो माने रेडिएशन होवे, बैता होवे, चूल चले जावे, and that's how most people think, which is a very wrong way to approach things. मैं आप सभी को ये बात बताना चाहता हूँ, on the eve of World Cancer Day, if you move early, आप इस एनिमी को अटैक कर सकते हैं. You have to move early, और उसके लिए आपको you have to listen to your body, you have to see the symptoms. कभी-कभी क्या होता है ना, आप symptoms देखते नहीं हो because let's face it, we live in a society जहां पर काफी चीजें बहुत टैबू है. Like how many of you know कि cervical cancer का one of the first symptoms that you have is irregular periods. अगर आप अपने husband को, अपने son को या अपने brother को या family members को नहीं बताते हैं, then that cancer spreads to the other organs and it becomes extremely dangerous. So feel free to ask in all your questions, because the reason why we are here is to save a life for anyone watching this. Shubhro De, thank you so much, Arvind, for this session. I had to thank Dr. Suma Chakraborty. मैं तो सिर्फ mediator हूँ. Extremely important interview. Mr. Shaunava Mukherjee says this is so informative. Yes, Sumita, please ask questions. We want you to ask questions. I have a list of questions, especially breast cancer को लेकर, शुमादी, जो मैं आपसे सवाल करना चाहूंगा. Okay, let's answer this question. Are all types of cancer genetic? I think that's a very valid question to go. चाहे वो lung हो, blood हो, cervical हो, oral cancer हो. अगर family history है, माय फादर और माय ग्रैंडफादर अगर उनको कैंसर हुआ है, इज देयर अ चांस कि वो मुझे भी हो सकता है?
Acha. If you ask the question is, are all types of cancers? Definitely no. Not all types of cancers are familial. Some cancers are. जैसे कि मैं breast cancer का example देती हूँ because that is my area of expertise. So out of, if you take 100 women with breast cancer, about 5 to 10 of them develop cancer because of familial reasons. यानी कि वंशगत जिसे बोलते हैं, यानी कि जीन जो है वो अपने दादा दादी या मौसी हो या फूफा हो, फूफा से शायद नहीं आता, लेकिन फ्रॉम द पिशी और फूफी, so whenever you're connected genetically to something, there is, of course, we are alive because genes have been given to us and we have grown out of that. So
राइट
5 to 10% of breast cancer is familial or hereditary. So the history is very important. But इसका मतलब ये नहीं है किसी के घर में अगर ब्रेस्ट कैंसर हुआ है तो डेफिनेटली दूसरों को होगा. That is not true. Usually hereditary cancer, breast cancer for example, occurs when a woman is much younger, in their 30s, 40s, 50s ऐसे. So if you have just your mother or a distant relative, sort of second degree relative, for example, who had cancer at the age of 80, you may not be at any increased risk because their cancer may not be familial at all. So a small percentage of all cancers tend to be familial, but most of them are not.
Right. So let's move on to breast cancer. I have had an aunt, I have known for a long time. Sadly, she suffered, और हमने उनकी sufferings, देखी है. Cancer also takes a toll on the family. मैं आप सबको बताना
Yes.
चाहूंगा, ये सिर्फ उस पेशेंट का फाइट नहीं है. उनके हस्बैंड, उनके फादर, उनके सन, उनके डॉटर, and often it's a fight where the entire family needs to come together. This is like war, as I rightfully said. थोड़ा early move कीजिए and move. Can I give you one suggestion to everyone watching this? If you have a feeling कि आपको कैंसर का diagnosis है, one of the first mistakes that we make or often is we go vegetable shopping. हम Google से information लेते हैं. I'm sure Shumadi would agree because she deals with patients all the time. It's something that I need to be very vocal about today. आप अपने दोस्त को फोन करते हैं, दोस्त के दोस्त को फोन करते हैं, उनके फैमिली ने क्या किया, किस डॉक्टर के पास गए, अच्छा वहां जाने से ठीक होगा. These are all the myths that you need to get out of your headspace. You need to take the decision with a leap of faith. आप डॉक्टर के पास जाएं, सारे सवाल करें. No question is a bad question. No question is a good question. Every
Absolutely.
question is a life-saving question. आप जब ये सवाल करते हैं, आपको कॉन्फिडेंस आता है. आप देखिएगा पेशेंट डॉक्टर के साथ कितना कंफर्टेबल फील करता है, rather than you telling the patient नहीं एक डॉक्टर के काছে যাবো ওখানে যাবো. Then there is so much anxiety that also comes in. So that's my first suggestion to you. Don't go vegetable shopping. That's a term we use. Vegetable shopping मत कीजिए. Trust the doctor and go and do what needs to be done. Rumnadi is asking, okay, Rumnadi's father had cancer and we have a good habit of eating vegetables. What is the best diet you recommend, doctor? Let me rephrase this question. Shumadi, breast cancer avoid करो जनो, since you mentioned that's your area of specialization also. Breast cancer avoid करने के लिए मेरा lifestyle कितना important है? Is physical activity important? Is diet important? And I have done my research to ask you this question. Dairy or milk? Some people say it is the reason for breast cancer. कितना सच है ये?
That is a myth, I think. So if I start off, healthy lifestyle is absolutely important because breast cancer, as we know, more and more, we have come to know that it's a lifestyle disease. In the sense that जितना आपका जैसे कि for example in the East, India में अभी भी if you take per 100 women, इंडिया में कम, जैसे 100 में से कम, if you compare with say UK or America or other Western countries, we still have per 100 fewer cancers. Like for every lakh women that we have, in the UK there are 95 breast cancers, whereas in India there are only 26 breast cancers. Okay, so it is a lifestyle disease, and the more Western we get with our lifestyle, the more the risk increases. This is something that's accepted. Fresh leafy green vegetables, absolutely right, absolutely spot on. Please have it. Not only does it protect you from breast cancer, it protects you from lots of other things: diabetes, hypertension, obesity, lots of other things. Exercise, very very useful. 4 to 7 hours, 4 to 7 hours of exercise, which I would say is moderate to heavy exercise per week. यानी कि दिन में 45 मिनट से 1 घंटा रफली अगर आप मॉडरेट टू हेवी एक्सरसाइज करते हैं, वो घर का काम भी हो सकता है, घर पोछना, या कुछ करना, ये भी हो सकता है, ऐसा नहीं कि वो एक्सरसाइज नहीं है, अगर आप करते हैं तो यू हैव अ प्रोटेक्टिव इफेक्ट अगेंस्ट ब्रेस्ट कैंसर। फिर और भी कुछ लाइफस्टाइल थिंग्स, जैसे कि बहुत ज्यादा एज के बाद बच्चा होना, बेसिकली क्यों ऐसे होता है, we have a hormone called estrogen in women, and when we become pregnant or when we breastfeed, the predominant hormone becomes progesterone. Okay, so that
Okay.
progesterone has a protective effect on breast cancer. So if a woman has children earlier in life, say in early 20s, mid 20s, and has where instead of having the children later on in life in their 30s or late 30s or 40s, that break in the estrogen level comes much earlier in life, and that has a
Okay.
protective effect. So better not to postpone having a child for many years. If you have the right life partner and if you can go ahead, then I suppose it is, sorry, I suppose it's worth going ahead and having children. Breastfeeding has a protective effect. Research has shown that having 2 to 3 children uh, protects against breast cancer by about 40% or so. So more you break the effect of estrogen in the body and bring progesterone to work, the more likely you'll be protected from breast cancer. So all our age-old customs or traditions are actually quite valid in protecting us from breast cancer. So lifestyle changes are very important. Exercise, good food, fresh food, not putting on weight, especially after menopause, is a huge thing. Increasing weight आफ्टर मेनोपॉज, यानी कि पीरियड्स बंद हो जाने के बाद, जब औरत का पीरियड्स बंद हो जाता है, उसके बाद यूजुअली वेट पुटिंग ऑन करने का एक टेंडेंसी होता है. थोड़ा वेट पुट ऑन करना नॉर्मल है उस एज के लिए, लेकिन बहुत ज्यादा यानी कि ओबेसिटी जिसे बोलते हैं, ऐसे होना, ये भी ब्रेस्ट कैंसर का एक रिस्क फैक्टर है. तो लाइफस्टाइल इज एक्स्ट्रॉर्डिनरीली इंपॉर्टेंट फॉर ब्रेस्ट कैंसर एंड टू प्रिवेंट ब्रेस्ट कैंसर. एंड लेकिन हम ऐसे नहीं बोल पाएंगे कि आप ये करेंगे तो आपको डेफिनेटली नहीं होगा. अनफॉर्चुनेटली लाइक सर्वाइकल कैंसर में हमको पता है कि ज्यादातर एक वायरस कॉज करता है. ब्रेस्ट कैंसर में हमारे पास वो इंफॉर्मेशन नहीं है. So we know all these are risk factors, but we don't know exactly how much what will protect you. So it is best to have healthy lifestyle. Smoking alcohol, too much alcohol increases risk as well. So the less we smoke, the less we drink alcohol, and the more healthier we are. That is definitely going to have a protective effect on breast cancer.
My takeaway from this conversation was I did not know breastfeeding is, a medical way, to just avoid breast cancer. It reduces your risk of having breast cancer.
That's right.
Sumita, I'm going to answer your question. Shaunab, I'm going to answer your question. Lekin, the very basic, simple question that I have, and this is something जो मेरे aunt के साथ हुआ था. हर घर में when the cancer happens, Shumadi, the first thing is complete rejection of the idea যে আমার ক্যান্সারটা হতে পারে. মানে you have fear, you have anxiety, you have stress, but you don't have acceptance, which is a very wrong way to go about it. If I accept कि मुझ में गलती है, then I can go about getting things done and rectified. लेकिन अगर मैं उसे acknowledge ही नहीं करूं और accept ही नहीं करूं और मैं denial में रहूं, I think that goes the same for everything in life, not just cancer, then that becomes a bit of a handicap. In a way, I'm answering your question, Shaunava, that you actually put, ki, how would you provide them the much required strength to fight cancer and the treatment procedure? Breast cancer, Shumadi, the first thing I have seen is mammography করতে হবে, ব্যথা হবে. Mammography मुझे नहीं करना है. That pain, and I'll be very vocal, people start looking at alternative forms of medicine. Ki, without any surgery, without any chemo, without any radiation, without any surgeon intervention, I will go for this. Eta niye theek ho jaye, I will rectify my lifestyle. But the mammography is such an essential part of the treatment, for breast cancer patients. Everyone watching this, please, if you could just answer this question, is it painful? And how important is mammography?
Okay, so there are two things you've asked. I'll answer the second question first. How important is mammography? Now, what is mammography? It is basically X-ray of the breast. Okay, now to perform this X-ray of the breast, we basically compress the breast. जो breast है उसको हम क्या करते हैं, 2 plates के बीच में उसको press करते हैं. That is how we take the picture. अब बहुत लोग ये सोचते हैं कि जब हम प्रेस करेंगे तो थोड़ा प्रेशर तो डालते हैं, लेकिन इतना ज्यादा प्रेशर डाला जाता है कि बहुत ज्यादा दर्द होता है. ऐसा बिल्कुल नहीं है. More than 90-95% of our patients don't complain at all. Of course, there is compression. Of course, they may feel a bit uncomfortable, a little bit. But I am yet to see anybody who has, maybe no, I'm wrong. I've seen one person who has avoided mammography for a long time because of the pain. But with newer machines, with digital mammography machines, and with newer machines where the compression that we put on the breast is slightly different or less than what the older machines used to put, or the यहाँ पे कुछ machines अभी आए हैं जहाँ पे patient can have control also, ऐसा भी है.
Okay.
What we do in our unit, for example, we tell the patient, you tell us when it is hurting. And अगर हमको लगता है कि उस स्टेज पे जहाँ पे पेशेंट कंप्लेन कर रहा है कि दर्द हो रहा है, इफ आई कैन गेट अ गुड पिक्चर देन वी टेक इट. अगर हमको लगता है कि नहीं मिलेगा अच्छा पिक्चर, देन वी काउंसिल द लेडी कि थोड़ा और. एंड यूजुअली वीमेन अंडरस्टैंड, एंड यू शुड रिमेंबर दैट दिस प्रेशर इज ओनली फॉर अ फ्यू सेकेंड्स. ऐसा नहीं कि घंटों प्रेशर है. तो रियली आई वुड से, इज मैमोग्राफी पेनफुल? इफ यू वांट मी टू आंसर इन वन वर्ड, आई वुड से नो. And I would say, if rarely for some women there is pain, then consult your doctor. We can give you sometimes paracetamol that may help. We can take care when we do your mammography, when we are applying compression. So all those options are there. Don't decide not to get it done, because it is absolutely vital in diagnosing the cancer, or sometimes reassuring you that cancer नहीं है. ऐसा नहीं कि आप लंप लेके गए, ब्रेस्ट में एक लंप आया, आप जब जाते हैं 80% ऑफ द टाइम्स वो कैंसर नहीं रहेगा. इट विल बी बिनाइन थिंग. एक सिस्ट हो सकता है, या नॉन कैंसरस ट्यूमर हो सकता है, या कभी कभी नॉर्मल टिश्यू थोड़ा हार्ड हो सकता है उस जगह में. सो प्लीज डू गो, बिकॉज मैमोग्राफी आपको ये बताएगा कि यहाँ पे कुछ कैंसरस है कि नहीं है, एंड इट इज एब्सोल्युटली वाइटल.
And for anyone watching this, if you feel that we're talking about topics जो हम relate नहीं कर पाते, I'll be very frank on this. My mother had a lump, and we had to get a mammography, as ma'am rightfully said. Normally क्या होता है, अगर आप lump देखते हैं, then you start having these little doubts कि is this cancer? It turned out to be a tissue problem. 80% of the cases आपको लेकिन वो mammography करना होगा just to find out. So take your mother, take your aunt, take anyone in your family who's complaining of anything like this. Don't have any taboo about these topics. Na ami bolte parbo na tara ki bhabe. This is the biggest enemy. The enemy lies within. शौनब, आपने कई सवाल किए हैं, जिसमें से ये सवाल आई थिंक ऊपर वाला ही दे सकता है. जिन्होंने कभी स्मोक, अल्कोहल नहीं पिया, टोबैको नहीं लिया, they've never drank tea. I don't know, tea causes anything, but they die out of throat cancer. Is there a way to prevent this? There are so many questions coming. Please अपने सवाल keep commenting, because we intend to answer all your questions. And I like to ask one question to you, ma'am. What is the difference between a mammogram and ESG? It came from a listener today morning. ये ESG actually होता क्या है?
USG होगा.
USG, हाँ. I think I'm sorry for the medical term, but उन्होंने कहा मैम के একটু জিজ্ঞেস করবেন যে USG আর ম্যামোগ্রাফির মধ্যে কি ডিফারেন্স আছে?
আচ্ছা, USG ম্যামোগ্রাফি হচ্ছে ব্রেস্টের এক্সরে, আর USG হচ্ছে আল্ট্রাসাউন্ড. যেভাবে আপনার পেটের আল্ট্রাসাউন্ড হচ্ছে, বা যখন মহিলা প্রেগনেন্ট হয়, প্রেগনেন্সি আল্ট্রাসাউন্ড হয়, একটু পেটের উপরে জেল দিয়ে দেখা হয়, ওরকমই আমরা ব্রেস্টেরও আল্ট্রাসাউন্ড করি. তো যখন একটা মহিলা আমাদের কাছে লাম্প নিয়ে আসে, তো আমরা তখন ম্যামোগ্রাফিও করি, আল্ট্রাসাউন্ডও করি. দু রকমের জিনিসকে আমাদেরকে দেখায়. নাও হাউ টু পুট দিস টু সিম্পলিফাই ইট, মেনি থিংস আর সিন বোথ অন ম্যামোগ্রাফি অ্যান্ড অন আল্ট্রাসাউন্ড, but certain things are seen only on mammography and certain things are seen only on ultrasound. So usually when a woman comes with a lump, we will do mammography first and ultrasound, both at the same sitting. And then if we think something suspicious is there, we will do a biopsy after that of that area.
Okay. Requesting all you to share this live, not just comment, but अपने profile पे जरा share कीजिए. If anyone is missing this conversation, I think you learned a lot and there's still so much more to talk about. सुमिता का सवाल है, let's take two questions together. Sumita and Joyita, both of you. Joyita has asked a bit of a technical question. Should the presence of polyp in certain organs like intestine worry a person ताकि वो cancer develop कर सकता है? And Sumita has asked this question, is there a vaccine? Please discuss about the vaccination of cancer. I think what Sumita wants to ask is, breast cancer के लिए क्या कोई vaccine है? You mentioned about cervical cancer. Breast cancer के लिए, do we have any vaccination that can prevent it from happening?
No, not yet, because we do not have one causative organism that has been identified by for breast cancer. You can make a vaccine if you have a particular bug, a bacteria, a virus or something that you know is causing, जो cervical cancer में होता है, but breast cancer में अभी तक कोई ऐसा definite vaccine नहीं है. And the other question about polyp that you were asking, now polyps can be completely benign, यानी कि एकदम नॉन कैंसरस. ट्यूमर्स, जब हम बोलते हैं कि कहीं पे भी ट्यूमर है या ग्रोथ है, दो तरह का हो सकता है, एक कैंसरस हो सकता है, एक नॉन कैंसरस. तो पॉलिप्स आर कैन बी कंप्लीटली बिनाइन, यानी कि नॉन कैंसरस. यूजुअली इफ देयर इज अ पॉलिप, they will do a colonoscopy or something, some test like that, and take a biopsy of that and check whether it is benign or not. Okay. So even
Okay.
if it is benign, often it is kept on follow-up.
Okay.
Now there are certain conditions where we call multiple polyposis syndromes, जहाँ पे बहुत सारे polyps होते हैं intestine में, and some of them can change into cancer with time. So polyps के लिए एक uniform answer हम नहीं दे सकते हैं. So what I would advise or request our lady who has questioned us is to talk to her doctor, see what her reports are. She may have a completely benign non-cancerous polyp, nothing to worry about it.
Right.
Or if
So
a doctor wants to keep it on follow-up, she just has to follow her doctor's instructions.
Joita, please, consult the doctor, or you can get in touch with Dr. Suma Chakraborty in Peerless Hospital. Okay. A friend of mine is having breast cancer, Rumnadi ka kehna hai, and she's having a lot of dental problems. Why is it so, doctor?
Now, I don't know exactly what the dental problems are. What happens sometimes is, I'm just trying to guess here, is when we give chemotherapy, then the immunity of the person goes down. जैसे कि सबको पता है कैंसर का जब ट्रीटमेंट कभी कभी कीमोथेरेपी से दिया जाता है. ब्रेस्ट कैंसर में देयर आर मेनी सिचुएशंस वेयर वी यूज कीमोथेरेपी, एंड तब कुछ चीजें होते हैं जैसे इम्यूनिटी डाउन होता है. तो यानी कि किसी भी इन्फेक्शन के विरुद्ध फाइट करने का जो कैपेसिटी है वो कम हो जाती है. तब कभी कभी डेंटल इन्फेक्शंस हो सकते हैं. That is what I'm thinking. If she's saying dental problems, my guess is that I don't know exactly what those problems are. And
मैम आपकी हिंदी इतनी अच्छी है that if I would have said this, मैं किसी भी इसके against बोलता. आपने विरुद्ध कहा, and then I realized when was the last time I had heard someone saying विरुद्ध. Sorry, yeah.
नहीं, और एक चीज जो हो सकता है वो है कि when chemotherapy is given, sometimes थोड़ा the intestine, the cells which are lining our intestine, जो bowel wall बोलते हैं, वहां पे थोड़ा कीमोथेरेपेटिक एजेंट्स जो है वहां पे भी काम कर सकते हैं. तो कभी कभी थोड़ा malnutrition हो सकता है. So if there is bleeding from her gums or something, she may have vitamin C deficiency, that kind of thing. So that is again something you just speak to the doctor who is giving chemotherapy, and they will be able to address it very effectively.
All right. So I have I can see all the comments here. My moshi had a lump and she also tested. Please go to Peerless Hospital and get in touch with Dr. Suma Chakraborty. उनके पास reports लेकर जाइए. That's my first suggestion to you. Dr. Shubhrajyoti Bomik has joined this conversation, and I think he's a common friend to me and Shumadi.
Yes.
In fact, he's a common friend to most of us. A man with a wonderful smile. Great discussion. She's a human radiologist with great skills. Gem of a person. That's how I introduced her, Shubhrajyoti da. Mr. G. Balasubramanian says, बहुत अच्छा explanation for all the queries. True, very nice हिंदी. देखिए आपकी हिंदी के लिए काफी अच्छे कॉम्प्लीमेंट्स मिल रहे हैं.
नहीं, मेरा की काम में गलतियां हो जाती है और मैं बहुत खराब तरह से फंस जाती हूँ कभी कभी.
अनंत कौन कहता है कि कैंसर के बारे में बात करते समय आपको इतना सीरियस होना चाहिए? We can have a light conversation, but a very meaningful conversation. I have one. I'll break this into two questions for you. I think I saw Shornavo ask this question. Yes, I'll just scroll up. Yes. How do I ask my wife if she's having any problems? Mammography is painful. We have already answered that question for you. So breast cancer की क्या symptoms है? Number one. Can I ask three questions in one question? Breast cancer की क्या symptoms है? Husband का कितना responsibility है to deal with his wife in a very, very, very meaningful manner and not rubbish it off when it happens? Number two. Number three is what is a BSE, which is a breast self-exam?
Okay.
And how
Very
often
nice
should I do it?
Okay, I'll answer all of them. So, symptoms of breast cancer, basically very simple. The commonest way it presents is a painless lump. तो
Okay.
ऐसा एक गांठ जिसमें कोई दर्द ना हो, या वो बहुत जरूरी है. बहुत सारे औरतें नहीं आती है क्योंकि उसमें दर्द नहीं हो रहा है. They decide that it's not painful, so it is probably nothing to worry about. But unfortunately for us, breast cancer presents as a painless lump most of the time. So कोई भी गांठ आपको अगर लगता है कि ब्रेस्ट में ये नहीं था और ये मैं अब महसूस कर रही हूँ कुछ दिनों से, तो प्लीज डॉक्टर के पास जाइएगा. निपल से अगर कोई डिस्चार्ज आ रहा है, जैसे पानी आ रहा है, प्रेस करने के बाद नहीं, ऑन इट्स ओन, जिसे हम स्पॉन्टेनियस निपल डिस्चार्ज बोलते हैं. सो इफ देयर इज ब्लड या वाटरी कुछ आ रहा है निपल से, एंड then you have to go to your doctor, because sometimes something inside the breast may be causing this discharge. So there may be a tumor which is causing this discharge. तो आपको जाना चाहिए. निपल का अगर शेप बदल गया, निपल अंदर की तरफ जाना शुरू किया, स्पेशली एक साइड का, दोनों का नहीं, विथ एज ब्रेस्ट में चेंजेस आते हैं. वो यूजुअली सिमेट्रिकल होते हैं, यानी दोनों साइड पे होता है. but if the nipple is behaving differently on only one side, या skin में कोई change, if you think that the skin is being pulled inwards, एक dimple जैसा skin पे दिख रहा है, या skin का कोई color change हो रहा है. The other rarer things are if one breast is suddenly becoming much larger than the other, or the opposite of that also, it's shrinking down. These are all things, but one key word, what I would like to say is change. If you see change in your breast, okay, then go to the doctor. कोई अगर बदलाव दिखता है, যদি আপনি আপনার ব্রেস্টে কোনো একটা নতুন জিনিস দেখছেন, তাহলে ডাক্তারের কাছে যাবেন. Now, how do we decide what is new? That I'll answer with BSc, breast self-examination. So what is breast self-examination? It's a very simple technique. It takes only a minute or two. The woman herself checks her breast every month. Typically, better to do it after the periods. Maybe you fix a day 7, day 5. I'm saying after the periods because if you check it once before and once after, the breast will feel different and you'll get scared. So always maybe after the periods, fix a date and feel your breasts yourselves. And every month when you feel it, after 3 or 4 times, you will yourself know, what is normal for you. And that is breast self-examination. You self-examine your breasts. And if there is any change, you go to the doctor. Now, the other question was about the husband's role. I would say the husband's role is extremely important. Probably more important.
I'll sorry to interrupt, not just husband, but I'm referring to all the male members in the family. The father, the brother, could be the brother-in-law, could be a friend also in this case. So, yeah.
Yeah, absolutely. I think the most important thing you said, Arvind, is that openness, isn't it? We have to have breast is also a part of the body. And breast is not a tabooed organ. There is nothing abnormal about breast. The breast is one of the most beautiful organs of the body, which a woman uses to nurture her baby. There can be nothing more precious than that. There can be nothing more spiritual than that, actually. So don't look at it as a tabooed subject. And instead, let there be open discussion, open conversations. Watch these kind of programs together with your family. That kind of helps ease the inhibitions we have. So, for example, if it's a male member of the family, a husband, for example, in this case, you can tell your wife, you can go on the net, you can go to some certain websites. Don't go to any website. Go to only those which we say, for example, there is a good website called www.bisi.co.in. That is bisi.co.in. That is the official website of Breast Imaging Society of India. I'm a founder member of that, and 13 of us came together and we started this about few years ago, and now it has become a huge organization. We have a video on breast self-examination. You can take a look at it, and you can help give your wife the link and she can look at it. If you can also, if you want, if sometimes women are scared to self-examine because they think, oh my God, kya milega? And anything they feel there may be a cancer. You can examine their breast, for example. If you are a husband, you can, if your wife is not happy to do it, you can examine a breast for her. And if you're, for example, you can ask her from time to time if she's fine, if there are any problems. I think you can have an open chat, just like she should be able to have an open chat with you about things which you may feel or we may feel tabooed when it comes to men. There are a lot of things like that.
Right. I would just like to mention, as I said, my mother had a very similar problem a couple of years back. So, when she had the lump, the first thing that she did was she told my father, I need to go for an examination. And painless lump tha, jaise aapne kaha. But the minute we got everything done, touch wood, we discovered that there was nothing, dangerous about it. And just a tissue growth. Now, the thing that I want to tell you is, agar aap apne ghar pe ye openness lekar nahi aate, then what happens is, from a non-medical perspective, this is how cancer works. You have a certain organ that could be infected with a tumor, your body will send you the signals. You could have, as Bam said, skin marks, discharges, kuch na kuch hota rahega, but you'll find out that something's wrong. If you don't stop it at that level, it spreads to the other organs. जो पड़ोसी वाला organ है, वो आपका lung हो सकता है, आपका liver हो सकता है, आपके tissues हो सकते हैं, आपका spine हो सकता है. I don't know where different areas it starts spreading. Then it becomes very difficult for the doctors कि वो इसको treat कर सकें, और आपके लिए दर्द बहुत ज़्यादा बढ़ता है. और ये दर्द इसलिए बढ़ता है, not because the doctor cannot cure you, it's because you did not have the courage to open up about those symptoms and talk about it. And that's why I believe such conversations are so important. इस वक्त मैं और डॉक्टर सुमा चक्रवर्ती जो कर रहे हैं, डोंट बी इन डिनायल कि आपके साथ ये नहीं हो सकता. That's my only request. My only request is to have an open mind with everything in life. And when I say an open mind, not anxious कि होने वाला है, but just to do the right thing and take the right decision when you need to. Uh, okay, Rumna Bhattacharya, my staff Shamuli had cervical cancer और केमो देने के बाद she hasn't lost her hair, so people were disbelieving her. Why is it so?
Okay, now again, I'm not an oncologist, but I'll try and answer. Certain medicines are available now which do reduce the risk of they are more targeted chemotherapy. So the reason we lose hair, क्यों होता है? So let me explain it like this. What is cancer? Cancer is a group of abnormal cells जो बहुत abnormally grow कर रहे हैं, बहुत fast grow कर रहे हैं, और इतना वो fast grow कर रहे हैं कि वो कोई useful काम नहीं कर पाते हैं. So they become like a lump of abnormal cells or abnormal tissues which are of no use to the body, but because they are growing so much, they use up all the metabolic elements like glucose and everything else. They use it up and they utilize it for their growth. Okay. Now, when we give chemotherapy, it targets all this cancer. Why does it target it? It targets all the rapidly dividing cells. जो cells बहुत बहुत rapidly divide कर रहे हैं, fast divide कर रहे हैं, उनको target करता है. So it targets the cancer. तो कैंसर छोटा हो जाता है या चला जाता है, लेकिन उसके साथ हमारे बॉडी में और जो भी सेल्स है जो रैपिडली डिवाइड करते हैं लेकिन वो नॉर्मल है, जैसे हमारे बावल का जो लाइनिंग होता है वो, या फिर हमारा हेयर जो झड़ता है वो भी, दैट इज वन ऑफ द रीजंस. सो now what is happening, more and more newer drugs are coming where the treatment is more targeted to just the cancer cells in certain types of cancer, so that these side effects of hair loss, side effects of vomiting, because the gastrointestinal tract, yani ke jahan the bowel is not affected that badly, so these side effects we are to some extent we are able to reduce them. So I don't know if that may be the reason why she had it. I have no idea about exactly what her treatment was, but I'm guessing it was something like that.
Right. In fact, I know someone who had cervical cancer, और उनको तो actually chemo की जरूरत भी नहीं पड़ी. She had something called brachytherapy, which is again a lesser form of chemo or radiation. So, I mean, you don't even feel anything. So I think it depends on individual to individual.
Absolutely.
I had a question today, ma'am. This came from I think Shriponadi. What is a triple negative report? ওনার রিপোর্টে যদি ট্রিপল নেগেটিভ আসে, and she specifically gave me a call to tell me আমি কমেন্ট করব না অরবিন্দা, জাস্ট যদি জিজ্ঞেস করতে পারো what does a triple negative report mean?
ওকে, the triple negative, breast cancer যখন আমরা দেখি তখন আমরা ভাবি যে আমাদের মনে breast cancer in the layman's term it's one disease, but actually কিন্তু when you go to treat it, it is not that. There is a spectrum of disease. কিছু কিছু breast cancer আছে যেটা early detection যদি হয়, সেই পেশেন্টের লাইফ স্প্যান একটা another person who does not have a diagnosis of breast cancer তার থেকে কিছু কম নয়. It's exactly the same. And there are certain other types of breast cancers which are very aggressive. So different spectrum আছে, মানে অনেক বড় spectrum of breast cancer আছে. তো এই যে cells আছে, the cells that are there which are the cancer cells, ওদের সেল ওয়ালের উপরে কয়েকটা রিসেপ্টরস হয়. মানে সেলকে যদি একটা গোল জিনিস বলে ধরি আমি, তার ওয়ালে মানে এরকম জায়গায় কিছু রিসেপ্টর হয়. সেখানে আমরা ইস্ট্রোজেন রিসেপ্টর বলি, ওই ওয়ার্ডটা আগেও এসছে, ইস্ট্রোজেন হরমোন আমরা কথা বলছিলাম তখন, ইস্ট্রোজেন রিসেপ্টর বলি, প্রোজেস্টেরন রিসেপ্টর বলি, আরেকটা জিনিস আছে হারসেপ্টিন. সো দিস আর অল ডিফারেন্ট রিসেপ্টরস. এই একটা সেল থাকলে তার ওয়ালে বিভিন্ন রকম রিসেপ্টরস থাকে. এই রিসেপ্টরের ব্যাপারে নলেজটা কেন ইম্পর্টেন্ট? যদি এটা ইস্ট্রোজেন রিসেপ্টর পজিটিভ থাকে, মানে যদি অনেক কোটা ইস্ট্রোজেন রিসেপ্টর থাকে, তাহলে আমি টার্গেটেড ট্রিটমেন্ট দিতে পারি, টার্গেটিং দ্যাট রিসেপ্টর টু কিল দ্যাট সেল. Okay. So we look for these three main receptors: estrogen, progesterone, and herceptin. আর এবার যদি HER2 নিউ বলি, herceptin ঠিক না, HER2 নিউ, I suppose they both okay. So যদি কোনো রিসেপ্টর না থাকে সেলের উপরে, এটাকে ট্রিপল নেগেটিভ বলা হয়. মানে না ইস্ট্রোজেন রিসেপ্টর আছে, না প্রোজেস্টেরন রিসেপ্টর আছে, না HER2 নিউ রিসেপ্টর আছে এই সেলের ওয়ালে, মানে সেলের গায়ে. তখন কি হয়, যেই ওষুধগুলো আমরা এই রিসেপ্টরকে টার্গেট করতে দিই সেগুলো ইউজ করতে পারি না, অন্য ওষুধ ইউজ করতে হয়. Certain other medicines have to be used. So that is the implications. When we say somebody has triple negative, that has implications for their treatment. We have to target them with different medicines.
Suchishmita Sharma, such a beautiful discussion. Thank you so much. Please share. That's my only request to you. Joita Ghosh, do cancer cells release any toxins हमारे body में apart from taking up all nutrients?
Do cancer cells release any? Sorry.
Any toxins in our body apart from taking up all the nutrients?
Some cancers do. Some cancers actually produce certain things which are which can cause quite significant problems. Not all cancers do. Not basically key hoy. With cancers, it is not so much what they are producing in terms of nutrients. The cancer cells themselves spread. With
Okay.
time, if there is no treatment, like you just mentioned, they spread to adjacent structures, and then they can spread by blood, so they can go far away. They can spread by what we call is the lymphatic system, which kind of parallels the blood system. That's another circulatory system we have. तो एक lymph glands এই যে গ্ল্যান্ডস বলি আমরা লিম্ফ গ্ল্যান্ডসের থ্রু লিম্ফ্যাটিক সিস্টেমের থ্রু থেকে বা ব্লাড সিস্টেম মানে ব্লাডের থ্রু থেকে small cells from the tumor can just travel to different parts of the body, and they are literally those very cells of the tumor which can go and start growing in other places. যেরকম আপনি বললেন যে ব্রেইনে হতে পারে, লিভারে হতে পারে বা এইসব বলছিলেন, basically these are literally the cancer cells themselves going and spreading. So that is the fear with cancer, that if you don't treat it, then it might have an adverse effect on not just that organ but other organs in the body also.
Right. So if you've seen this movie Lorenzo's Oil, it's a brilliant movie, एक English movie है, and it's a true story about a father and mother coming forward to save the kid. और एक they realize that the olive oil, basically to cut it short, has a certain property that acts as a preventive measure. That's why इस oil को Lorenzo's Oil कहा जाता है. But वहां पर जो father है, he is not a doctor, but he looks at things in a very simple way. So I'll try and follow that analogy to explain what Shumari is also trying to say very nicely. is सोचिए आपका घर, योर बॉडी इज लाइक योर हाउस. तो उसमें एक ड्राइंग रूम है, उसमें एक किचन है, उसमें एक बाथरूम है, उसमें एक बेडरूम है. सो दैट्स योर लंग, दैट्स योर गैस, दैट्स योर डाइजेस्टिव सिस्टम. देयर डिफरेंट रूम्स, बट ऑल ऑफ देम कॉन्स्टिट्यूट टू व्हाट यू कॉल योर हाउस. अब ये जो कैंसर है, ये अनवांटेड मेहमान है जो बिना आपके बुलाए आपके घर में एंटर कर चुका है. फिलहाल के लिए वो आपके एक रूम में फंसा हुआ है, लेकिन अगर आपने उसे वहां से नहीं निकाला तो बहुत जल्द वो आपके दूसरे बेडरूम में आएगा, फिर आपके किचन में आएगा, फिर आपका पूरा घर वो टेक ओवर करने वाला है. सो व्हाट डू? You go and get him out of that room as quickly as possible. I'm sorry, Shumati, I think that's the best way I understand
That's
cancer.
perfect. That's absolutely perfect. It's perfect.
Yes. Okay. I have one question for you, and I think this would be the most important question as we near to an end to our discussion. कैंसर की जो टैबू इश्यूज है वो तो हमने डिस्कस कर ली. During the treatment, families need to be more sensitive. There is a certain element of spirituality which I believe is very helpful with medicine. Yes, you have a good doctor, आपको मेडिसिन मदद करता है, but equally important is keeping a very good ambience or environment or energy in the house, ताकि वो इंसान स्ट्रेस ना फील कर सके. And that sometimes I believe challenges you as an individual. सिर्फ उस पेशेंट को नहीं. So in a way, what I'm trying to tell you is, when you are diagnosed with cancer, या आपका कोई जान पहचान का इंसान, करीबी रिश्तेदार, someone you really love, you have to make a list of points that you need to fight that cancer. उसमें courage, determination, discipline, focus, बहुत सारी ऐसी points आ सकती है. And then look at that paper and thank that cancer. What I'm going to say may not make sense to you right now, but when you thank that cancer कि अगर तुम ना होते तो शायद ये qualities मैं तैयार नहीं कर पाता, is a much better way to go about it, rather than saying কেন হলো, কি হলো, আমি তো কিছু করিনি, আমি তো ঠাকুরকে প্রত্যেকদিন পুজো করি, ঠাকুর আমার সাথে কেন করলো. That's a very wrong way to go about it, because God is telling you, in your suffering there must be some meaning. That's what you understand when you fight cancer on a very personal and individual level. Shumadi, your message to everyone, when the cancer happens, how do we go about it? The spiritual bit of it also, which is so critical for recovery.
I think you're so perfect. I don't think I can say better than you've said, actually, but I'll say something as well, which is, it is not just a physical disease, which is what you're trying to say. It is not just a physical disease. It's like a bolt from the blue. When we get this diagnosis, it is something, even when sometimes I've told the patient that it is most likely going to be a small cancer, and we're doing the biopsy. Even after that biopsy, often patients then ask me, "Kharab kichu nahi to?" because we all don't want it. Like you said, either we are in denial or we don't want it so badly. We don't want it. We want our simple lives to go on as they are. So as they're going on. So I think physical part the doctor can treat or the nurse can treat, or you can take a medicine. But your emotional needs, I think your family is going to help you. The spiritual needs, whatever way you feel you can connect spiritually to somebody above, if you believe in that, then those are all very, very important. And the most important thing is, don't look at it as if it is some kind of a demonish disease. Okay, it is just like any other disease. You see, there are so many people who are dying because of high blood pressure or diabetes, but somehow we don't have the same taboo with them. We just say, oh, not to boy diabetes ache. We accept it, but that is also a very silent killer disease. We have to be aware of that as well. But I'm just saying, put this in the same bracket. This is also just a disease. It is not
Right.
anything else. And there is excellent treatment available today, very good treatment available. So you can really give it a good fight. And around you, you'll find so many cancer survivors today. Cancer has become around us, but if you look around you, there are a lot more cancer survivors also than there were maybe 10 years ago, 50, 20 years ago. So I think it is very important to be positive. And at any time, if you're not positive, just try and get up and go for a walk. Break that negative thought or negative feeling, or just pick up the phone and call a friend, or watch a movie, or do something. But it's the problem with the treatment is that it's quite long, isn't it? It's not like एक operation हो गया. Often there is a long duration. So if you have any interest, if you like reading books, ऐसे कुछ करके अपने फिजिकल बॉडी को देखभाल करने के साथ इमोशनल एंड स्पिरिचुअल नीड्स, इसके लिए भी सोचिए. सोच के put some, it may just be calling some friends or whatever. Put some, like you
मैम
said, I mean, I can't say
मैम
any better than you
मैम
said.
रेडियो को ऑन करना है बस. 94.3 रेडियो 1 किशोर कुमार
एकदम
और
अरविंद
जिनको
is
लेकर
there.
आने बस. दैट्स इट. और कुछ नहीं
That's it.
चाहिए.
Arvind नहीं,
So
कुछ नहीं
all day
चाहिए.
long we are there. I think this has been a fascinating discussion. I could go on and on, but I wanted to keep it short and sweet. In by my standards, we've been close to an hour, but हमने बहुत अच्छी बातें की.
Okay.
What I really feel from the heart is, when you have a problem, uh, don't go discussing it with too many people. 1000 लोगों से आप डिस्कस करते हैं, 1000 ओपिनियंस आती है, और 1000 ओपिनियंस पे 1000 कंफ्यूजन वाले पॉइंट्स आते हैं. सिंपली गो टू द डॉक्टर, और डॉक्टर से जितने सवाल आप कर सकते हैं, यू हैव अ राइट टू आस्क द डॉक्टर ऑल द क्वेश्चंस. और जो डॉक्टर, आई मीन, just go to Dr. Suma Chakraborty. With a smile, she can answer all your questions. First, I hope you don't have a problem. That is my first, prayer. But if you do, or anyone in your family does, please remember the name Dr. Suma Chakraborty, head off to Peerless Hospital. And by the way, I love your hospital, ma'am. एक तो मुझे Peerless के साथ मेरा बहुत दिल का रिश्ता है. I don't know if Dr. Bhomik is still watching this right now. एक कमेंट कर सकते हैं कि नहीं. But Peerless में enter करने से, all the staff members, to everyone there, extremely friendly. When I walk in and I see this, a large Krishna wala temple also right near that pharmacy,
Yes,
it
yes,
gives
yes,
a
yes.
very, very good vibe. So many smiles at Peerless, always. Of course, hospital has its own share of tragedies also. कुछ अच्छा news भी मिलता है और कुछ बुरा news भी मिलता है. And just as I'm about to, drop off, Joita has messaged. My colleague died due to breast cancer. Sorry to hear that. She was undergoing all treatments or follow-up. She worked perfectly fine for 2 years. It suddenly spread to lymph nodes. It took a few months for her to succumb to death. What could have saved her? I have to thank you, Joita, because I forgot this question. It was written here, but because I was discussing this, ma'am, cancer ki relapse korte pare. I have defeated that enemy. I have taken him out, but can it come back? Joita makes the point about, someone relapsing after 2 years of treatment.
Sadly, it can. Sadly, it can, and often that's because there is micro metastatic disease, which is disease which the scans will not pick up because they're so microscopic and very tiny. The disease might have spread somewhere else to some lymph nodes or some other organ where it is very small, and it takes time for it to grow and show up on any scan. So that is why in medicine we say that any scan is not 100%, whatever test it may be, because there is a limit to how much a scan can pick up, whether it is a PET scan or whether it is a CT scan or whether it is a mammography or whatever. So, unfortunately, yes, it is just like, say, I would look at it a bit like, say, I was never diagnosed of cancer and I've just got the diagnosis now. It is pretty much similar to what Joita is saying is, मैं समझा नहीं पा रही हूँ, मैं ये बोलना चाह रही हूँ कि ऐसा है कि वो नॉर्मल हो गए और उनको फिर रिलैप्स हुआ, ऑलमोस्ट लाइक अनदर हेल्दी पर्सन गेटिंग द डिसीज, ऐसे ही महसूस होता है। तो व्हाट आई एम ट्राइंग टू से इज, इफ यू हैव हैड कैंसर वंस, डोंट स्टे इन द फियर कि अंदर में अभी भी है, अभी भी है, अभी भी है। थिंक यू आर नॉर्मल। और अगर आपको फिर से 2 साल 10 साल बाद होता है, ऐसे ही किसी और को हो सकता है जिसको कभी नहीं हुआ हो। सो वंस योर ट्रीटमेंट इज फुल, प्लीज बिलीव and think that you are normal. And if a relapse or a different cancer or something has to happen, we don't have any control over it other than doing our regular, checkups and having leading a healthy lifestyle and all that. So there are many people I know, sadly, once they've been diagnosed of cancer, they are not ever convinced that they are fine. ऐसे भी नहीं होना चाहिए। एक बार जब
Right.
पूरा ट्रीटमेंट होता है, डू टेल योरसेल्फ आई एम नॉर्मल, आई एम फाइन,
Right.
एंड उसके
Ma'am,
बाद जो होगा होगा।
ma'am, one question, that I have, and I would also love to volunteer in such support groups in my free time, beyond radio as well. Do you have support groups जहाँ पर कुछ people can come together, talk about it? Past cancer patients would come sit together, because I think a conversation like this is so enlightening for more people to know. So if I'm suffering from breast cancer, एक physical recovery है, उस emotional recovery के लिए भी can I connect to other patients to talk? Is there anything like this? Just like to know.
No, we did have something similar like that when we organized a yearly conference called Peerless Breast Imaging Update. तो उसमें हमारा एक सेशन था जहाँ पे we had cancer survivors who came and spoke. But this is a very good idea, Arvind, and we can take it forward. Maybe we can start something like that, and it would be lovely for somebody like you, of such a high
I,
profile, to
I really
participate,
like,
to give that
I,
exposure.
yeah, I would really like to say this. Anytime something like this happens, ma'am, please feel free to let me know. I would love to come
Definitely.
moderate and
Yeah,
interact with everyone.
sure.
Runadi,
We will do
Arvind's
that.
voice gives a boost for the day. I don't know about that, but thank you so much, for that. Ma'am, बहुत अच्छा लगा आपसे बात करके, and thank you so much for taking our time. Uh, on World Cancer Day, I wish all the cancer patients and their family members quick recovery. My prayers for everyone who has lost someone because of cancer. And I say this from the heart. My thank you to all the doctors, all the nurses, just about everyone who take the right decisions at the right time to reach. The doctors go through a tough time. Uh, I mean, it's even hard for me to imagine how many lives could have been saved अगर हम उस टैबू को जरा रिजेक्ट करें, द टैबूज की दुनिया क्या कहेगी और लोग क्या कहेंगे, ও আমার ব্রেস্টে লাম্প আছে আমি কার সাথে গিয়ে কথা বলবো, if I tell my husband he will rubbish it off, I will not look attractive. All these are demons in your own mind. Just get it out and simply go and talk to someone in your house, because that talking is the difference between life and death. Thank you so much, Dr. Chakraborty, for joining
Can I
us.
just say something? One quick thing. I mean, thank you very much for this wonderful opportunity, and thank you so much for actually taking so much of my responsibility and doing a fabulous job with what
No,
you
you're
said. Everything you said was fantastic, and thank you so much for everyone who's joined. And that's a big, huge support, and it's only awareness that can actually save us really. From awareness gets to early detection. Early detection means saving lives. So this has been a
Feel free to
wonderful
share
session,
this
Arvind.
video. Feel free to share this video.
Sure, sure.
And
Thank you.
also, Shumari, তোমার সাথে দেখা হচ্ছে next time I come to,
Sure, absolutely. Yeah,
PLS. We
absolutely.
should catch up, and it'll be great fun to just to
And
see
we
you
should
once.
form that group.
I am all
The
in
support
for
group.
it. The day you
Yeah,
form the group,
great.
I'll be there to moderate for every weekly session that you have if you want.
Fantastic. Thank you so much. Thank you.
Thank you so much,
Thank you very
Shumari.
much.
Thank you so much.
Thank you. Bye-bye. Namaskar.